Hello, and welcome to It's All About Your Health, Straight Talk with Dr. Nancy. My name is Nancy Greer-Williams, and I am a health researcher for the University of Arkansas for Medical Sciences.
HPV, which is a human papillomavirus, is a sexually transmitted virus that frequently the person does not know have any symptoms. And it is the most common sexually transmitted disease, so common that most adults, by the time that they're 50, if they have ever been sexually active, have contracted the virus at some point in their life. It is the only sexually transmitted virus that we know of that causes invasive cancer in humans. HPV is caused by sexual intercourse. The most common ways are through vaginal intercourse and through anal intercourse. And the third most common way is through oral intercourse. So more than likely, there's genital contact from one partner to the other, same sex or heterosexual. Usually with the males, they are very, very unaware unless they have experienced some itching in their genitalia area. But with females who undergo pap smears up until last year, most females got them every year. Abnormal pap smears are 95% of the time caused by human papillomavirus. And many people are shocked to find that out because they've been treated for abnormal pap smear but never really understood that that was the causative agent for their abnormal pap smear. This is why we do pap smears, is to look for the destruction from the human papillomavirus. You can see your most current provider and tell them what your history is. The history is going to vary from person to person. There are almost 100 different types of human papillomavirus. There are some that are really, really cancer-causing, and there are some that are just annoyances in that they will create mild forms of disease. But those that have the aggressive cancer-forming ones can progress to cancer very rapidly and have to stay on top of it, meaning that they have to keep their appointments with their healthcare provider. If you talk to your healthcare provider, they usually just from your history can tell you which one it probably was. Now in current times, in the last 5 years, when you get a pap smear, if it comes back abnormal, they automatically do a HPV typing on the fluid that was sent to them. Prior to that, we did not automatically do it. It was a very expensive test because it was not a common test. There have been 2 vaccines that have been developed to protect you against human papillomavirus. It was actually developed and approved by the federal government back in 2005. It was originally approved only for girls. The recommendation is that you give it to your child prior to them becoming sexually active, male and female. Now the recommendation is to give it to males and females. The recommended age is 11 to 12. If you're beyond the age of 26, the vaccine is not available to you. And it has to do a lot with the time at which most people are going to have their highest risk of behavior, which is in their 20s. And a lot of that is from multiple partners and partners who have had multiple partners. And that's where your highest exposure rate comes is, your late teens, college students, grad students that are still in that very high-risk behavior group. The vaccine is just like a lot of the other childhood vaccines. It's an injection. It is a shot. It's a shot, and you have to get 3 of them. The recommended time is within 6 months to receive all 3 of your vaccines in a scheduled manner. Typically is given to you in your arm. There's really not a whole lot of side effects from it except soreness in the arm, just typical vaccine, just from the shot itself. The recommendation is that right now is that you have to get all 3 shots. They are studying whether or not one injection will work, but it would probably take 10 or 15 years for them to prove that it is as effective as the 3-dose vaccine. It is actually, for the Arkansas Department of Health, one of the recommended vaccines for the 11 and 12-year-old. So if your child goes to the doctor as they should, they would tell you about the vaccine. Because it's not mandatory, they will explain to the parent what it is and then proceed with the vaccine afterwards. The Gardasil vaccine actually protects against 4 different types of the human papillomavirus. There are 2 types which are most commonly known for giving you genital warts, and then the 2 types that protect you against invasive cancers. It is recommended for boys and for girls. Civirax only protects you against the 2 viruses that give you invasive cancers, and it is only approved to be given to girls, not to boys. So if you want your male child to get it, then they will need to get the quadrivalent one, which is Gardasil, which quadrivalent is just 4 different. It protects against 4 different types. The vaccine is not as effective in someone who has already been diagnosed with human papillomavirus, but it is still recommended to give it to them. We just let them know that it is not as effective as had they not had HPV in their history before. But if they're still in that age range, we still give them the vaccine. The vaccine, of course, is given to them prior to them becoming sexually active. But of course, abstinence will also protect you against getting the virus, and protection, if you are going to have intercourse, to protect yourself either with the male condom or the female condom, because those 2 things in it will also protect you from getting other sexually transmitted diseases.
Thanks for watching. Our goal for this program is to give you good information that you can trust on health topics that you can use for you and your family to live a long, healthy life. If there is something in this message you want to know more about and you live in the state of Arkansas, take a moment to talk with one of our health experts at your local area health education center.